they currently experience when they were working on site. So my role principally has been to ensure that we have the appropriate technologies rolled out in position so that we could continue to protect the organization.
Wonderful. And so as we thought about the theme of the conference, Our World Now, and how the COVID-19 pandemic has changed the way that we function altogether, but also has really thrown us into the realm of leading through change and leading through crisis. We talked a little bit about an article that was recently published by MIT in the MIT Sloan Management Review that talks about some of the functionalities, some of the key things that leaders have to do when they're leading teams, and how now leading teams is really multimodal. It is really in some ways the same, but in some ways a little different because of the crisis and the pandemic. And so it talks to the idea that there's 4 key things that we tend to do best face to face, like collaboration and innovation and acculturation, that now have to be done in different modalities. And so I asked Dr. Gaddison and Dr. Rodriguez to share a little bit with me about the pivoting that has happened and how leadership has played a role in that pivoting. So Dr. Gaddison, if you wouldn't mind sharing with us a little bit about how the leadership you've experienced and even the leadership that you've had to practice has changed.
So I'm fortunate, and I want to share with you guys before I give my response that I'm really proud to be a part of an amazing organization, MD Anderson Cancer Center. And we were blessed to have leadership that fully embrace leadership. And so many of the concepts and principles that we learned about as part of the doctoral program are integrated within the way the organization is managed. So much so that we have a leadership institute, which our senior leadership is required to complete specific training in. And then we have staff support resources, have a different course that kind of complements what the leaders are learning. So when this pandemic occurred, we were able to build upon the foundation we had in place in terms of leadership. And some of the things that historically we did in terms of monthly town halls were accelerated. So we now meet multiple times during the week. We receive communications from the president, but there are also video conferences. And then this is followed by an email. So everyone doesn't receive or have the opportunity to participate in all of the scheduled activities. But because it's an electronic format, it enables people to stay abreast of what's going on. And special committees were formed. And from a doctoral perspective, this is very close to what our core is. Surveys were done periodically where we were engaged to find out how we were adapting to the change. And as we provided feedback, the system was tweaked to respond to some of the information. So yes, leadership has fully embraced the methodologies that we've learned. And as a result, I think we will be a stronger, greater organization on the other side of the pandemic.
Thank you so much. So Dr. Rodriguez, Dr. Gaddison mentioned communication, and I know that both of you are in the healthcare industry, which is probably the industry that has been most affected by the pandemic specifically, but you guys are in support functions within that industry, not necessarily in the front line delivering it. And you talked about, Dr. Rodriguez, the idea that communication plays such a key role in how you've been able to serve the medical professionals that deliver the service, and how you lead your team about the critical piece that communication plays. Can you tell us a little bit about that?
So when it comes to working with the medical staff, yes, we're not on the front lines, but the services that we provide enable them to accomplish their goals. So we have to understand their workflows and how they function to be able to come up with solutions that are most efficient for them to use. So this, for instance, I will give you an example. The telemedicine solution, which we spoke of earlier, is one that wasn't really widely used, but now with the COVID epidemic, there's been, to minimize the patient contact that are COVID positive, we've had to come up with quick solutions to make it work. So we've leveraged, actually leveraged Zoom meetings that are HIPAA compliant, which is for patient information. So we've utilized that quickly we basically scrounged up some solutions, iPads that we had, and we put together something that would work. We put together a workflow by discussing it with the leaders and how they function and what would work best for them. And then we also provided one thing at the hospitals is that, during this COVID epidemic, they were not allowing a lot of visitors. So that also allowed families to be able to communicate with their families from the outside. Patients to be able to communicate with their families, which was very important because you have to understand some of these patients were not, didn't leave the hospital, they passed. So it was important for us to be able to provide those to the families to be able to have that last contact with their family member in the hospital. So, but how does it go back to the leadership side of it? So emotional intelligence has become very important on how I understand, I have to be aware of how my employees are feeling, how they're reacting to the situation. Many of them have been very afraid just to come to work. Now, in my personal role, we are working on the infrastructure side. It is not something you can easily support from an offsite location. You have to be there to touch the hardware, to work on it, to repair it. So we've created, solutions for them to minimize the contact patients by creating units that were isolated, and we created workflows for them to, again, minimize their impact. Now, discussing with them, one of the major concerns of this, and this was part of the research that I conducted last year, this last year as part of my doctoral program, was the impact of COVID-19 and how leader member exchange and organizational commitment during that period, how that functioned with each other. Now, leader member exchange is the dyadic relationship between the leader and the follower and how we interact. And there's an in-person and an out-person. The in-person is basically we have high communication, and there's a better sense of there's more loyalty in that, and that's what we want to achieve. But how did that impact organizational commitment during the COVID epidemic? So what I saw was that, from in 2019, the unemployment rate of IT professionals was 2.2%, which was roughly half the national average, which is very low. But from the start of the COVID pandemic in March to the August when my study concluded, it was up 92%. It was 2.6 and it went up to 4 points. I believe it was 4.6, 2.4 to 4.6. So what that told me is that people, and I saw it in the hospital, is that my employees were starting to worry about their jobs. On a daily basis, I would get, am I going to have my job next week? Is my job still going to be here? And you have to have that communication with them, or that in-group or high-quality LMX to communicate that they have security here, their role is secure. And it's very important to the success of the organization, because effective leaders, there really isn't a one-size-fits-all solution to leadership when it comes to these situations. So you have to go and understand what the employee is feeling and be able to communicate with them and communicate what the importance is of their work to the organization. So leading into that, so that goes into where the continuance commitment part, the research found, which is LMX had a negative correlation with the continuance commitment, which is not something that was typically found in other research. We see effective and normative commitment. Those are the other two types. Effective is where they want to stay with the organization because of something in it, like the work environment or the employees I work with. Normative is where they feel they ought to stay with the organization due to the loyalty. But continuance is where they remain because they need to, because of the costs associated with leaving. Those costs could be, my paycheck, my benefits. So we saw that as something that was new. So it really needed to be addressed. We needed to discuss with the employees that they are secure in their positions and, you know, their role is secure. That's was their major fear. So that interaction between them was very important and has been and is ongoingly important to me and how I communicate with them. Now, one thing I want to mention is I know that everybody that's a leader has those employees that are difficult to deal with. It's just part of leadership. So even though it's, you know, we're going through these trying times, it's still very important to make sure that we engage with those employees. It takes a lot of effort, but it's important to the success of the organization to get them on board.
Yeah, yes, indeed. Great. Thank you for sharing that, because one of the things that was mentioned in a lot of the literature that talks about how leading teams is multimodal, is that there's a common thread or a thread that goes through all of the different hats that leaders are having to wear now, even more so than before COVID, and that is trust. And so what you talk about with the leader member exchange and building commitment and reassurance in employees by leaders, a lot of that is associated perhaps to trust or building trust. And so I wanted to ask Dr. Gaddison if you could, from a project management perspective, if I recall correctly, a lot of the things that you've worked with and researched have to do with effectiveness of project teams and how they build that reputation and that trust for effectiveness. Can you talk to us a little bit about that and how that has maybe had to pivot a little during COVID?
I think you're on mute, Dr. Gaddison.
Yes. Naturally, there's extensive collaboration among team members. I was fortunate in that the teams that I have in place were formed pre-COVID. So there was already a level of trust that was built in the environment. And we have very mature processes and procedures and methodologies. So because the team was already formed and we've gone through the stages of forming, storming, norming, and performing, we just continue to operate at high efficiencies. Now, historically, we had contractors, and because of budget cuts and not knowing how long the pandemic was going to occur, we took measures to eliminate contractors. And clearly, since we're now working remotely, we don't have any consultants that come on site. To the extent that we had some projects that we identified could continue because we had financial commitments that we had to honor, then we continue to work with those organizations. But for the most part, we downsized, we reprioritized the projects that we were working on. And obviously, as you saw in the media, where some healthcare institutions were compromised by ransomware, people captured their intellectual property. We took measures to ensure that our organization remained safe and secure.
Yes, excellent. Thank you so much. It is always really a plus when you're a kind of a mature team that's worked with each other. But there's always that external factor that has to come into play when we think about how we navigate the terrain, right? And when we talked about earlier that whole having to be a champion for your team and for the work your team is doing with external partners. Can you talk a little bit about how having to be a champion for your work has come into focus with COVID, and also how, and this could be both or either of you, how creativity has been as much a resource as the actual financial resources that you referred to, Dr. Gaddison, because for us in academia, we found that when there were no budgets for something, we had to get really creative to be able to execute in the new modality. So can you tell us a little bit about your experiences with that?
So my experience was, Richard introduced the concept of telehealth, telemedicine. So that was something that was on our horizon, but we had not fully implemented. We're exploring. Obviously, we're now in a pandemic. We had to redesign our schedule, meaning instead of operating from a traditional 8 to 5 for many of the patient visits, we evolved to a 24-hour cycle. And that enabled us to reduce the number of staff that was physically on site, spread them out, and allowed us to spread out the patient care. So instead of having a large volume of people on site at one time, we could spread them out. Historically, we only operated Monday through Friday. We evolved to a 7-day-a-week cycle. We took advantage of some of our remote facilities to provide patient care. We also encourage many of them, because we have people coming not just locally within the Houston area, but across the globe and across the country, to partner with some of their local healthcare physicians to get maybe some of their tests done, or maybe even some of their treatments. We engaged in partnering with organizations that we had not previously thought or interacted with to provide patient care. MD Anderson has been very good about creating a bubble around the healthcare environment. Many of our patients, their immune systems are already compromised by the treatment that we receive. So unless we were required to be in a clinical environment where there was patient interaction, we were not allowed on site. Very similar to what Richard shared. They restricted access to the healthcare environment to only the patient without supporting families. So we implemented initially temperature checks where as you entered, they would monitor your temperature to make an assessment of what your level was. That was evolved. Technology again was implemented where we had thermal cameras, which enabled them to evaluate a group of people entering the building opposed to one-on-one. Plexiglass was installed to protect employees when they were going through the intake process. Regardless to who you are, in this environment, you're required to wear a mask. When you enter our environment, you can keep your mask, but you must put on a mask that we provide. And the reason is all masks are not created equal. And we want to ensure that our employees and the patients are protected. So you can double mask if that's your preference, but you must wear a mask. So it was little things like that. There were some positions that could not be done remotely, but they could because the people didn't have the skill set. It was just not an option. So they created rollout assignments or rolling assignments where maybe people were deployed in other areas to ensure that they continue to be employed. So that's an example of the kind of leadership and the agility and the creativity that was employed in the environment.
Great, thank you so much. Dr. Rodriguez, any examples of creativity in your particular area?
So it was the same. It goes back to that telemedicine solution. I mean, that was the major one. That was how do we put this in place? And then also the workflows, as Dr. Gaddison discussed, is how do we help people work remotely? So there was a lot of sessions and training sessions that we had on how to connect and how to utilize some of the applications they needed to function. Now, opposite to Dr. Gaddison's organization, where they're very mature and they're set, we were in the middle of transformation of our organization during the COVID epidemic, which made it much more chaotic. So when you talk about being a champion, I had to be a champion both for the organization, but also for the employees on my side. So I had to speak to their concerns to the org, and I had to champion the org's drive or future state where they wanted it to go with the employees. So it was a very delicate balance. So it makes it much harder to deal with that in the middle of the COVID epidemic. But since all this was already planned pre-COVID. Contracts were in place. There was no backing out. We had to move forward. It just made it much more difficult. But, you know, if you're there as the champion or the leader for the group, you can help to moderate that and appease both sides.
The great, excellent examples of how many different stakeholders that we in leaders end up championing and being catalysts for the changes that have to happen right in the new environment. So great examples. I'm going to open it up for questions, but before I do, I'm going to read a couple comments that have been posted in the chat in case you haven't seen them. One is, I really appreciate Dr. Rodriguez. We share very similar experience in our professional career, and his advice has helped me to find my way and purpose. One of my lifelong goals in completing the PhD program. So thank you, Dr. Rodriguez. That was from Dirce Hernandez. And then Dr. Gaddison, he mentions that he also works in information security, and one of his previous managers now works for MD Anderson. And so thank you for all the amazing work that the organization does.
Thank you.
So we do have a question for the panel. The question is, what long-term strategy is leadership in your respective organizations pursuing to balance workforce effectiveness among work from home and work from the office personnel as vaccines become available? So what long-term strategies do you know of that leadership in your organizations is pursuing to balance these two modalities?
I can begin.
Okay.
So we are fortunate in the Houston area. MD Anderson was the first institution to receive vaccine. And so obviously they began with vaccinating people who had patient-facing position. And it was voluntary. It was not mandatory. So they gave employees an option to get the shots. And then they used the scale that was originally identified, 75 and older, folks who were 65, who had health risks, and they continued down. So after they completed the initial vaccination with the people on the front line and patients, they also provided vaccination for patients as well. Those people physically on site. Then they began to include patients who were actively being treated at the institution. So you may not physically be on site, but you're coming in periodically for ongoing care. So those folks began to get shots as well. Within the 75-mile radius of our office, that was, the definition that was selected. And so we've continued to move down. They eventually open it up to more employees based upon their demographics, high blood pressure, ethnicity, those folks that were really struggling. And now we're down to, many of the employees, it was only for employees, it was not for retirees. And so the question was, well, what about my family members? Can I get my spouse immunized? So they have now circled back around and they said, you can identify a loved one 75 and older to get immunized because those are the people who were highest at risk. So we provided them with care. And now we've progressed down to folks who have loved ones who are 65 and older who need to be immunized. So they have a strategy that they are employing, that we are employing to immunize folks. We also did, because we have a large population and our county facilities were overwhelmed with the testing associated with COVID, we have offered our research labs to test because they still had their day-to-day care to kind of assist with offloading the additional volume and processing the care for the patient. Thank you.
And similar to Dr. Gaddison is that the hospital here is providing the same services, the providing the vaccine to the employees that are on site. And on my group, for the infrastructure side, we're on site all the time. So we're considered one of those frontline workers that were first in line to get the COVID vaccine. Now, one of the other parts of your question was, how does this affect virtually in the future? So I think what organizations are starting to notice, and mine itself, is that they're breaking that norm that if I don't see you, you must not be working, because that's not the case. I think what people are starting to recognize and leaders are starting to recognize is that some people are more efficient virtually than they are in person.
Yeah.
It's because you don't have these interruptions or interactions with other people providing those interruptions. So, and I know in my sense, I expect right now I probably work 60% remote, but I expect it to stay similar it'll be probably stay the same after COVID, because what I found is I'm more efficient. What I end up doing a lot of times is I work at multiple sites, so I can spend hours a day driving. My longest location is an hour and 20 minutes away. So, that's 2 hours and 40 minutes round trip. So that's, a quarter of my day gone just on travel that I can't function and be productive. So I think that's what people are starting to notice. And there's other benefits associated with that, because there are costs to having employees on site. There are environmental costs, there's power costs, there's, just so many different things that having an employee on site costs. And they're starting to notice that as well too. So they're seeing the benefits of the virtual employee at this point.
Yes, indeed. And I think that question also kind of poses the questions and the concerns about what we've discovered is that we are working a lot more productive oftentimes for working virtually. And the fear is that it's going to change the product, right? For example, for us in academia, I think the back end fear is this going to change the amount of face-to-face we do versus virtual, right? And what that means to us as deliverers of education. So what are your thoughts about, do you foresee in the future post-COVID, do you foresee it changing permanently the way that services or your organization does its work?
So as it relates to MD Anderson, they've made a determination about there are some folks obviously they must be on site. There are some folks who 60% of their time, meaning 2 or 3 days out of the week, they can return on site. As for the organization I work in, and most of the people in IT, we are designated primarily as remote workers. That change was made as of January. And what they determined was around efficiency, we've become far more efficient. There are cost savings to the institution. And in terms of remote workers, I know myself personally, I did not like it. I live alone. I needed the social interaction. However, between Zooms, Teams, WebEx, there are, on a given day, there are at least 3 to 7 virtual meetings that are held. And they're not only held from 8 to 5, they are after hours and what have you. In fact, initially, one of the things I would share with you was leadership had to remind the leaders that just because you can access the employees using technology doesn't mean you necessarily should. So we were finding that you were receiving emails late into the evening because it's very convenient. You've gotten in the cycle of, oh, this has come to my mind, let me respond. Being mindful of the work-life balance, we've kind of restricted that. In fact, they are encouraging us, because we're a healthcare environment, to take breaks, walk, get up, to keep us from sitting all day, because you're sitting in front of the screens. And I see that as we move forward, some of the conveniences and some of the advantages that families are experiencing though it's challenging for those folks who have young kids, there are some inherent benefits to being able to eat dinner with your family, tuck your kids in the bed, and eliminating, as Dr. Rodriguez identified, the long commute. I've been remote for the whole year. I've not been back on site for the entire year, and there are many other folks across the organization who are in a similar position. So our new normal.
Yes, indeed. And that's a big part of how we pivot as leaders as well, right? How we, the considerations that we have for our teams. So great, thank you so much. So I'd like to invite our participants to ask questions. You can either unmute yourself if you would like to virtually go ahead and turn on your camera and ask questions of Doctors Rodriguez and Gaddison, or you can type your question in the chat if you have a question for Dr. Gaddison or Dr. Rodriguez. I'm trying to make sure that it's on here.
Well, if there's no questions, can I add to the last question?
Yes, absolutely.
So there's going to be some things as we move forward with this. Dr. Gaddison mentioned the remote work and the virtual, but I think there's going to be some things, as all of us that do Zoom meetings and any type of teleconferencing, that are hard to do over the meeting because of the crosstalk. There's a lot of crosstalk, people talking over each other in these meetings, and sometimes, and that's where I find it more effective. I still do go into the hospital for certain things, but it's usually for one-on-one personal meetings with, a CFO or CEO, because I can get my points across quicker and explain them in much more efficiently and easily to them when I'm there in front of them. So I think it's going to become a blended type of environment where we leverage the virtual environment a lot more, but there's still going to be some things where we have to come in to meet with them to discuss in person, because that's the way we can make our business case or get our points across, or just to help them understand what we're trying to accomplish.
So to follow up on what Dr. Rodriguez shared, in our environment, there are discussions about, do you really need to work in Texas? I mean, do you really need to work in Texas if you're a remote worker? There are some people who have been on their farm, on the lake, or in their RV, but they're still able to be functional and address whatever the concerns are. So it's changing. I don't think it's just changing for us. I think companies across the country are looking at that. In fact, you notice some of the organizations in Silicon Valley have said, hey, we're not coming back because people have adapted to working at homes. That's the cost. I mean, not only for the institutions, but for the individuals as well.
Agreed. And I believe it's going to be role-based. Based off of what your role is and what your function is will determine how efficiently you can work virtually. There's going to be some where we have to be there, and there's going to be others where I have people that have transitioned out of my market. They still live in Tucson, but they work for San Antonio now. So I totally understand that.
And so one of the things that pops into my mind is, as leaders, because it's going to become possibly more complex, right? Different roles, different modalities, different objectives in interactions, right? What are some tips that each of you would provide for navigating and managing all of these different complexities that are going to be present going forward? What are some leadership pieces of advice that you might provide?
Well, you going or I'm going?
I'll let you go.
I would say that there's, like I said earlier, there's no real playbook for leadership during a COVID pandemic, during times of crisis, or even after. Like something you may do today may not work tomorrow. So we have to constantly be able to adapt. And I think that that's what the leadership program has helped me do, It's learn all these different theories and how they impact my leadership and how they impact the follower on my end. So you know, it's about adapting to every situation and leveraging every type of tool that you have learned in the past to be successful.
Okay, I would like to add that, you know, in a traditional environment where you work face to face, you have when you bring new people into the organization, and that's where I see the biggest challenge as we bring new people into the organization that don't have the cultural history. They're not familiar with the norms that are the foundation for the organization. How do we incorporate that in a virtual environment? What is the proper mix to bring people on and get them immersed into a team environment? What type of leadership? You know, engaging only with the leader does not enable them to go through the stages of team development. So you have to have some kind of norm, be it virtual or what have you. You know, those traditional lunches that you go over and you talk about what's going on in the workplace, but you also share what's going on, your personal interests. How do we incorporate that in the workday so that we get those high performing teams? So I see that as a challenge that leaders will have to come up with solutions for in the future.
Completely agree. And it sounds like you both have experienced both really great examples of it and have been really great examples of it in your environments. So we'd like to thank you so much for one, sharing some time with us this morning, but two, being such wonderful catalysts and servants out in the world, representing us so proudly in the things that we strive to do here at the Lake, and the alumni that we have all over the world in all kinds of contexts doing such awesome things out there in organizations. So we really truly are grateful. I see Dr. Duncan has turned on her video. I'm not sure if she wanted to share something.
I just wanted to thank them for being part of this, and I think they've been great role models to demonstrate leadership from our program, and so I just thank both of them so much for being part of this of the conference.
Thank you.
It's my pleasure.
Thank you.
Yes, absolutely. I second that. And thank you so much. And thank you to all our participants for logging on to our session to share in some of the thoughts that we were sharing and how our environment has changed. I think that there is another session coming up. I'm not sure. I think it starts at 11:30. And so you're welcome to look at the schedule and join us for that as well. But again, thank you so much, Drs. Rodriguez and Gaddison. We truly appreciate your time with us today and the knowledge and insight you've shared. You make us all very, very proud.
Thank you.
Thank you. Thank you, everyone, for joining us.